Heart failure is a condition where the ventricles struggle to pump enough blood to meet body's demand. This can happen in two ways. Either the heart ventricles cannot pump enough blood during ventricular contraction, or not enough blood fills the ventricles during the diastolic or relaxation phase. In both conditions, it leads to reduced tissue perfusion due to impairment of forward movement of blood into the arterial system, and also accumulation of blood in heart chambers, leading to peripheral and pulmonary congestion. It could caused by reduced ejection fraction, impaired myocardial contractile function, decreased cardiac output leading to volume overload. It is caused by coronary artery disease, myocardial infarction, dilated cardiomyopathy, myocarditis, and hypertension. Preserved ejection fraction, previously known as systolic heart failure, is a type of heart failure where there is a stiffening of left ventricle. Reduced left ventricular compliance causes increased left ventricular filling pressure, increased left atrial pressure, and eventually causing pulmonary congestion. It is caused by hypertrophic cardiomyopathy, restrictive cardiomyopathy, aortic stenosis, and hypertension. High output heart failure is caused by demand for increased cardiac output due to anemia, thiamine deficiency, AV fistula, and hyperthyroidism. Heart failure is divided into right-sided and left-sided heart failure. Right-sided heart failure causes congestion of peripheral tissues, and we can see this in the form of dependent edema. GI congestion gives signs and symptoms related to GI distress. Liver congestion causes liver dysfunction. Left heart failure decrease cardiac output leading to decreased tissue perfusion, and we can hear this from patient in the form of complaints such as fatigue and weakness. Pulmonary congestion is also caused by left heart failure, and pulmonary congestion causes either impaired gas exchange, where there is cyanosis, hypoxia, and shortness of breath, or pulmonary edema, which gives a cough with a sputum and dyspnea. Right-sided and left-sided heart failure can be differentiated based on sign and symptoms. On right-sided heart failure, symptoms which we can hear from the patient are weakness, fatigue, nausea, loss of appetite, shortness of breath. Signs which we can appreciate on examination are parasternal heave, increased JVP, sacral and pedal edema, weight gain due to rapid accumulation of fluid, enlarged liver and spleen due to blood congestion. On left side, the symptoms could be shortness of breath, reduced exercise tolerance, cough, palpitations, confusion. Signs which we can appreciate on physical examination are pulse alternance, displaced apex beat, sign of pleural effusion. Pulmonary edema. Pulmonary edema can give signs in the form of basal crackles. New York Heart Association functional classification provides a simple way of classifying the extent of heart failure. One is no symptoms and no limitation in ordinary physical activity such as shortness of breath when walking or climbing stairs. Two is one slight limitation of physical activity, comfortable at rest, ordinary physical activity results in fatigue, palpitation, and dyspnea. Three is marked limitation of physical activity, comfortable at rest, less than ordinary activity causes fatigue, palpitation, or dyspnea. Four is severe limitation, experience symptoms even while at rest, mostly bedbound patients. There is no diagnostic criteria which have been agreed on as the gold standard for heart failure, but there are different investigations which are done in order to make the diagnosis and to evaluate the progress of heart failure. BNP is done in order to check for the heart failure because it is released from the cardiac ventricle in response to volume overload. For this reason, measurement of plasma BNP has recently become a very useful laboratory test to distinguish between congestive heart failure and other causes of dyspnea. Chest X-ray is done to check for enlargement of heart, to check for pleural effusion, alveolar edema, curly B line can be seen there, bronchoalveolar coughing, and ECG is done in order to check for enlargement of chambers, arrhythmia, and infarction. Echocardiogram is done to check for systolic and diastolic dysfunction, cardiac dimensions, wall motion abnormalities, valvular disease, pericardial effusion. Radionuclide angiography is done to check for left ventricular ejection fraction, and myocardial perfusion scintigraphy is also done in order to evaluate for the heart failure. Features of heart failure on chest X-ray can be seen as heart enlargement, which is a cardiothoracic ratio more than 0.5. Pleural effusion is the accumulation of fluid into the pleural space, and it can be seen on chest X-ray as blunting of costophrenic angle. Alveolar edema is edema into the alveoli. Curly B lines represent interstitial edema. It is thickened edematous interlobular septa, and bronchoalveolar coughing is haziness around the walls of bronchus. Acute treatment of heart failure is to treat pulmonary edema. Lasix is given in order to reduce the volume overload. Morphine is given to decrease preload. It is a venodilator. Nitroglycerin is a vasodilator. It is used with caution in right heart failure or right ventricular infarction, as it may precipitate cardiovascular collapse. Oxygen is given in pulmonary edema. Position should be upright, and positive airway pressure is given in order to decrease preload. Chronic treatment of congestive heart failure is to give AC inhibitor. It slows the progression of left ventricular dysfunction and improves survival. It is usually given in class 2 to 4 heart failure. Beta blocker slow progression and improves survival. It is given in class 1 to class 3 heart failure. Spironolactone has modulative benefit in symptomatic heart failure and severely depressed ejection fraction. It is mostly given in class 4 heart failure. Diuretics such as furosemide is used for diuresis. Inodrops like digoxin improve symptoms and decrease hospitalization, but there is no effect on mortality. Antiarrhythmatics such as amiodarone, beta blocker, and digoxin are given if there is a need. Anticoagulants such as warfarin are given if there is a need for anticoagulation. Thanks for watching. Please do not forget to like and subscribe. The link for the lecture notes of congestive heart failure is in the description below.